So, this is Wayne. Wayne is 57 years old. He's been a patient of mine for 4 years. And he's been on testosterone replacement therapy since October of '07, so that's just about exactly a year and a half. So what were the problems leading us to look at your testosterone health before we started?
Well, I've been essentially a diabetic for nearly 10 years, and back in '07 I started suffering some additional problems in terms of walking, and over the past few years I had problems with my eyesight and walking, and in '07 I was actually admitted to the hospital and they gave me a diagnosis of MS. And upon receiving that diagnosis and being unable to walk, and upon discharge, I saw you, and we discussed, my difficulty in walking, and you mentioned the possibility of, the fact that I may need testosterone, and we tried that,
Well, what was the things we were looking for the testosterone to help?
Well, we're looking. I mentioned my muscles. I had problems with my muscles tightening up and not having the strength to walk. And then my sexual dysfunction in terms of
So there was
having sexual desire and stuff with that nature.
Muscular weakness?
Yes.
You were aware of that?
Yes.
Okay, and you had had a loss of libido?
Yes.
Significant?
Yes, yes.
And erectile dysfunction?
Yes.
All of those were problems. Was there anything else?
Well, it was my sugar control as well, in terms of diabetes.
That wasn't so hot?
It wasn't so hot. Matter of fact, you had taken me off the pills and put me on insulin, which started giving me some measure of control. But still, in terms of my overall glucose readings, it wasn't in the range that it should have been.
Okay.
So that had to be taken care of as well.
You didn't have any problems with depression at that time?
No, not really. No.
But you did have some anxieties?
Well, yeah, I didn't know, well, before I got the diagnosis of MS, I didn't know what was causing the problems. I didn't know why I couldn't walk, why I couldn't run, and why I was having all these problems. And at first I thought I had a problem with my spine that needed an operation, and finally they found that, I had the scarring in my back, and they gave me the spinal tap and, the whole series of tests, and finally came up with the diagnosis of MS and with the MRIs and everything, and they finally came up to, gave me a diagnosis, so that kind of lessened the anxiety to actually have a diagnosis finally.
But still, at the time, before we started you on testosterone, there was still a factor, the anxiety?
Yeah.
Yeah. Okay, so we tested your testosterone level, and it was low, as would be expected in all adult onset diabetics. Type 2 diabetics are all testosterone deficient. So what did the testosterone do for you? What about the sexual part?
Well, it improved. It gave me the strength that I was hoping for. As a matter of fact, in '07 I took a cruise in '07. It gave me so much strength I hurt my back. I came to see you about the back problem it gave me. Unfortunately, it helped me my sexual increase my sexual desires, and
the erectile dysfunction got better.
It got better, and it gave me the strength to do the rehab that I needed to do in terms of my MS problems. And the only problem with the testosterone is that you had to do it every 3 weeks, and at the end of every 3 weeks, at the third week, you found yourself tailing off. You had to get to that, get your next shot, because it kind of, you find yourself wearing down in the third week.
Did we increase the frequency?
No, not really. I'm still in the every third week frequency right now. I need to adjust that because I do see myself wearing down every third week.
Well, we can go to every 17 or 18 days, and we can go to every 14 days if necessary.
Right.
But you found a significant increase in your libido?
Yes.
And a significant increase in your muscular strength?
Yes, definitely.
Gave you the desire and the ability to do the rehab?
Definitely. As a matter of fact, just recently I took a trip and I was away for 4 weeks, and I missed my shot by a whole week. And I thought since I got in here and got a shot that I would make up for that missing week. And it seemed like the shot didn't make up for that week. I'm still trying to catch up for that missing week.
Yeah, today was your second one after the missing week. Yeah. Did it do anything for the anxiety you were feeling?
Yes, it lessened the anxiety. Like I said, the main thing was that I know what my problem is, and I'm trying to deal with that. I know what's causing my problem, but I just have the normal anxieties right now, just getting older and dealing with my medical problems and seeing a doctor regularly. I joke with people now. I have a whole team of doctors now. I have a general doctor. I have a specialist. I have eye doctors. I have a whole team of doctors now. So I went from seeing no doctor, now I have a whole team of doctors. So that's the only anxiety I have now.
Okay. After a year and a half of being on testosterone replacement, has there been any negative side effects?
Side effects? I can't think of any. No, just the one I mentioned about it having the frequency in terms of it having to be done, on a regular basis and having it, wear down after a few weeks.
Right. Okay. Well, thank you very much for doing the video.
Thank you.
I'm sure a lot of people will be interested in this.
Okay. All right. Thank you.
Thank you much.
Okay. Okay.